Thanks so much for joining us here on News 12 this Tuesday night for this special report on the coronavirus pandemic. I'm Jessica Cunnington. Things, of course, are rapidly changing in our city and our world, and we're here to bring you everything you need to know every step of the way. So once again, this week we'll be talking with a doctor or city official each night at 7 o'clock to answer any questions you may have about the coronavirus and the pandemic. The number to call from 7 to 7:30 tonight is 718-861-6827, and we are so happy Dr. Rossi A. Hassad, an epidemiologist, statistician, and professor at the School of Social and Behavioral Sciences at Mercy College, is joining us once again tonight. Before we get to your questions tonight, a quick update from the governor and officials today. Governor Cuomo, along with New York City's Mayor Bill de Blasio, continuing their calls to the federal government for help in stopping the spread of coronavirus as our state continues to have the highest number of cases in the country. Right now, there are more than 25,000 positive cases of coronavirus through New York State. Here in our city, that number is now up to nearly 15,000. Officials say 210 people have died so far from coronavirus in New York, and 131 of those deaths coming from here in the city. And so much happening, obviously. Dr. Hassad, we're so happy that you are back again and grateful for you to give us your time during this busy time. But people, have more questions as the day goes on. A lot of updates coming in today. We are hearing from the governor that the cases here in New York State are now doubling every 3 days. That's a lot. Obviously, we're seeing the numbers go up day by day, but now they just really seem to be rising. What are you seeing as this kind of continues?
Well, thank you. I'm happy to be back. It's very sobering to hear the World Health Organization characterizing the United States as fast becoming the epicenter of this pandemic, and to hear the governor referring to it as a bullet train. And I think those characterizations really capture what is happening here, because we are on a path to flatten this curve so as to buy some time in responding to the patients and cases that we will have. But what is happening now is the curve is becoming steep. So there is a quick rise, which means that the number of cases is far outpacing our ability to scale up our resources and healthcare infrastructure, which puts a huge burden on the healthcare system. So more than ever, it's very important that we all stay at home, stay away from crowded places, practice the protective measures, and not add to the existing burden.
Yeah, and we spoke about this now a couple of weeks ago when these measures, and at that time were very drastic, talking about possibly shutting down the city while we were just beginning to speak about shutting down restaurants and kind of our day-to-day lives, essentially. Now we've been in that now for a week now, or over a week. So our first Instagram question actually kind of touches on all of those things, all of these drastic measures that we've seen officials put in place. We need to obviously follow, as you were saying, but also now we've seen 100% of the non-essential workers around New York City have to stay home or work from home. But what about those who are essential, who are going to work every day? And that's what this question is about. For those of us deemed essential, how can we protect ourselves when we're traveling from outside counties into NYC for work? And also this goes for obviously essential workers moving around New York City as well.
Well, first, by just having the essential workers out, hopefully the density would be decreased. And on public transportation, we would expect, such as the train and buses, to have fewer people, which would allow for separation. Though I'm hearing that's not always the case. So what one needs to do is, if you are about to board a bus or a train and it's crowded, it may be wise to wait for another bus or another train. Because what remains is that you must separate yourself, you must practice or observe the protective measures, whether you are, essential or not. You're out there, you're at risk of becoming infected. So all protective measures must be practiced. So again, if a train is crowded, a car is crowded, or a bus is crowded, strongly advise that you wait for another so that you are in a car that has less density and meaning fewer people, so there's a separation between you and others.
Yeah, and I
And of
actually.
course, especially on public transport, make sure if you hold on to surfaces or anything on the outside that you wipe surfaces before and after. You wipe your or wash your hands.
Yeah, and I feel like a lot of people are avoiding obviously touching anything when they're out and about, but definitely on public transportation. I had to move a few cars today to just get to one that was more empty, where most of us were several seats away. So it's definitely an adjustment, but it is one that I think everyone is keeping in mind. And let's get to another social media question, and we can't really stress this enough. I know you have been telling us this from really day one. Will this flatten the curve of the virus? And I think they're just talking about all of the measures put in place.
Yes, social distancing and staying at home throughout history, those measures have helped to manage and control epidemics and pandemics. Now, one would say, well, why are we seeing this increase? And that's because we probably began the social distancing a bit late. So there was already widespread uh, spread in the community. So the numbers of cases we are seeing now are the people who have already been infected. So staying at home has reduced this number, and it will be a few weeks, 2 to 3 weeks, before we see that number go down. So because there's a large number of people out there who were already infected before we began aggressive social distancing. So those people still have those cases must go through the system and they will be reflected in the daily reports.
And I do want to touch on what the president spoke about today and get your view on it. Late this afternoon, the president spoke and came out kind of announcing that he wants to reopen essentially the United States and our country by Easter. So how feasible do you think that is? Is that realistic? Do you think that's going to be pushed back? I mean, obviously, he seemed pretty confident to come out and say that today.
Well, I appreciate the optimism, but if you ask any public health or medical specialist, they will tell you that doing so is a perfect recipe for disaster. I doubt that you would see that happening. After 2 weeks, there will be a comprehensive assessment of this to decide how much longer and how we should adjust the strategy. But it will still be social distancing. There's
Okay.
no way that we will relax this after 2 weeks. That will be to defeat the purpose of all of our efforts.
Wow. And that's a big thing to say there. It could be a recipe for disaster. So really just got to keep an eye on it here at home. And there's so much that we have to do. I mean, we're seeing we still are in so much need of this protective gear for our healthcare professionals and the masks and also ventilators. New York City just getting 400 today, but the governor is saying we need so much more than that, thousands more.
Absolutely. I mean, we have, it's believed, 20,000 ventilators in our federal stockpile. And the governor is appealing to the federal government to release those to New York. And the plan is which other state needs it, we will move them on as needed. But that's the crisis here because the key health problem that's developed here is pneumonia, is respiratory. And patients who are hospitalized, that's the care they require. And without that care, they will die. When respiratory care through a ventilator is required, it means that the patient needs that support. And without that, the patient is unable to breathe and will die. So that's very troubling here. And we know about 23% of those hospitalized require a ventilator in an ICU, intensive care unit.
Yeah, and that's just the reality. The numbers right there, and just so much is needed, so much work to still be done to make sure all of the workers have everything they need to treat these people that keep coming in. So we're definitely far from out of the woods, it seems. Just want to remind everyone watching at home, you can call in and ask your question or just voice your concern to Dr. Hassad about this pandemic going on. So the number to call is 718-861-6827. Just a reminder. Let's get to another social media question, though, because those have, of course, been pouring in the past several weeks. Letitia is asking, is this virus seasonal? Will it go away by the summer? And obviously the temperatures are going up, the sun is coming out. It's definitely feeling more like spring the majority these days. So will it go away or?
Well, we would hope that this virus would read the textbooks and follow the seasonal pattern. Most viruses of this sort, respiratory viruses, the flu virus, the cold virus, follow a seasonal pattern. But this particular virus has been a little different because we have seen tropical climates where the virus has spread or is now spreading. So we hope that it will follow a seasonal pattern and abate as the warmer period comes. But hope is not a strategy here. So we need all hands on deck. We need to follow the social distancing guidelines.
And that seems to be the best advice. Thank you, Dr. Hassad. We're going to be right back. Welcome back to this News 12 special report on the coronavirus pandemic. We are once again joined by Dr. Rossi Hassad, who has been joining us, an epidemiologist and professor who's been helping us out so much with this pandemic, just trying to understand it and really just go day by day with us. And let's get to our first caller of the night. Edwin is on the line from the Bronx. Edwin, can you hear us?
Yes.
Amazing. What is your question?
Well, my question is, why do you believe the message coming from China and Italy about the symptoms that everyone who contracts this disease has as being severe is different here in the United States? Because when the politicians are discussing the symptoms, they say it could range from mild to severe depending on the person.
So the question is, yes, the data coming out of China have shown that 80% of those who become infected will have mild or no symptoms. Am I answering the question? And the question has been asked about the validity of this data. And what we know is that the World Health Organization did send a team in to look at data from China, and their report was they were comfortable that these data are sound and should inform our strategies the strategies used in other countries. Now, we are seeing a similar profile in the United States, where the majority, 80% or more of the cases, do have mild or no symptoms. But we are also seeing a profile that wasn't seen in China, and that is younger age groups seem to also be at risk, are becoming infected, and are developing serious disease. Like 20% of our hospitalized cases now are between 14 and 44. That's not a statistic that we saw in China or elsewhere.
Yeah, and we can definitely learn a lot, obviously, from places like China and Italy, and that's what people like you, of course, have been studying and making sure that you keep up with all of the information coming out of there. Let's get to our next caller here. Debbie, I believe, is on the line. Debbie, can you hear me?
Yes, hi.
Hi, how are you? What is your question tonight?
Hi, I'm okay. I wanted to ask, I've seen them selling masks online. And considering, it's very hard to get masks, and I'm afraid to go shopping, I really am. Is there anything that we could put over our face or our nose that would protect us from breathing in, any of this virus? We have to go shopping.
Yes, Debbie, thank you for your question. Ideally, you would want for the general public, if a mask is to be used, the usual surgical mask. In a hospital setting, you'll want the N95 mask. But in the absence of both of those, any material that you can cover your nose or mouth with will be helpful. A handkerchief, a scarf, or anything of that sort. Any cotton, fabric, or material that you usually wear that you can throw over your nose, anything is better than nothing. It's not the ideal protection, but it does offer some level of protection. So yes, any cotton material or fabric you can use to cover your nose and mouth will serve to be helpful rather than nothing in a situation where a mask, if you are in the presence of a person who you suspect to be infected and you cannot separate yourself, then I would strongly advise that you do that.
And doctor, for people like Debbie, she just admitted she is really scared to go out, even to the grocery store, which is one of the few things open, to just go get food for her and her family. What advice can you give to people that really are scared to leave the house at this point, even for necessities?
And I certainly understand the fear, especially given the new data about the duration which this virus can linger on surfaces and as aerosols, meaning on air particles, though it's not at this time an airborne disease. I do understand that, but for a disease of this sort that is droplet spread, the 6-foot rule, meaning being 6 feet away from someone, washing your hands and covering your cough and staying away from those who are ill, would in general be suffice. Now, I wouldn't advise against someone who has a mask and wants to wear it. If it's a mask such as a general surgical mask, that's okay if you want to wear it, but it's not necessary. So if you have a heightened fear and you feel that a mask can relieve that, go ahead and wear it. It's not necessary, but it also wouldn't hurt if you have it and want to wear it. It sure would reduce your anxiety and fear and get you through the day.
All right, and let's get really quickly, just because I want to get one more question in. Liliana is on the line. Liliana, what is your question quickly?
Hi, doctor. My name is Liliana. I would like to know how safe I am in the street walking. I have to exercise because I'm pre-diabetic, and I have to, and I feel like a threat. I feel like I'm in danger, even if I have to do it. How safe I am in the street. Thank you, doctor.
Thank you, Liliana. You are safe to the extent that you are not in a crowded area or you are not in close contact with someone. If you must exercise, as in your case, if you must exercise, then you do so in an open area and alone. Not to be exercising with someone you do not know or whose status you're not aware of. The general rules apply. Social distancing, washing your hands, staying away from someone who is not well.
And great question,
Okay.
Liliana. We're going to be right back here. Stay with us. Welcome back. And before we end here with Dr. Hassad, who has been so helpful answering your questions tonight from all over the city, just wanted to speak about kind of your last message for the night. We're going to see you back here tomorrow night, but we were speaking earlier on just the burden on our healthcare system right now. How important is it to be following all of the measures put in place by officials?
absolutely important. And I would hope that after a week, we will have a higher degree of compliance with this. We need all hands on deck. As we usually say in public health, a case anywhere is a risk everywhere. Unless we do this together, we will not win. A broken, it will take away from the strength of the chain if the chain is broken. The transmission will continue.
All right, and really you've been saying that since the beginning, but you're really making it clear, especially with the numbers coming in and the amount of just stress that has been put on our hospitals and our doctors and our workers, that this really is the only way to go to get out of this situation. So thank you for that.
It is.
Yeah.
Thank you.
Well, remember, we will be speaking with a doctor, with Dr. Hassad tomorrow night, but also a city official on Thursday night to tune in at 7 o'clock for your questions to get answered during the special from 7 to 7:30. And remember, we have all the information about the pandemic right now on news12.com. Okay. Okay.